If a patient wanted to move from composite veneers to ceramic veneers, what's involved there?
Often I will advise patients nearly to try out composite veneers before going to porcelain veneers, even if that's only for a testing out period. And that's because it gives you time to get used to a new smile, a new shape, and it's less destructive than porcelain veneers. Not that the porcelain veneers nowadays, we can do quite minimally preparations on the teeth, but it's still irreversible, whereas your bonding, you can polish that off again. But so if we were then progressing, that's how we would do it. We would polish back to the natural tooth first of all. If the patient was happy with their bonding beforehand, we can use that bonding as a blueprint for how we will get our porcelain veneers to look at the end. But basically, yeah, we polish back to the natural tooth. If we need to do some preparation of the tooth, then we would do that next before putting on our porcelain veneers, because we need a certain amount of space for the thickness of the porcelain. But in a lot of cases, that can be very minimal, the amounts that you need to repair. It can just be a tiny amount at the finish line, so we know exactly where the veneer is going to fit on the tooth, basically.
Yeah. And what are the reasons that you find that people normally want to go from composite to?
The main reasons are that the porcelain veneers will last longer, they're harder wearing, and they're more stain resistant, and they can give a better final aesthetic result. They kind of have a shine that they keep that the composite veneers don't. They can kind of dull a little bit over time, so they need a bit more maintenance. You do need a yearly kind of review of them to polish them up, remove any staining. If there's chips or wear, that you can repair that. That's the advantage, I suppose, of the composite, is that you can repair it, whereas porcelain veneers are not as easy to repair. They're trickier, and if they break, you kind of need to replace the whole thing. But you're less likely to get there as quickly. They will last longer than your composite bonding.
Interessante.